Hello, everyone. I'm Sandra Levy, Senior Editor of Drugstore News. Today, we have Jenni Zilka. She's Senior Vice President of Community and Specialty Pharmacy at Cencora and President of Good Neighbor Pharmacy. Hi, Jenni. Thank you for joining us today. It's great to see you.
Hi, Sandra. Thank you so much for having me.
My pleasure. So let's get started. I know that Good Neighbor Pharmacy recently announced a collaboration with Enliven Health to utilize their clinical scope of practice and reimbursement solution. So can you tell us what's the significance of this collaboration for the role of independent pharmacies as far as patient care and pharmacy profitability?
Sure, I'm happy to share. We're very excited about our collaboration with Enliven Health. And the goal was to enable our member pharmacies to be able to access their, as you said, their scope of practice and their reimbursement snapshot solution. And at Good Neighbor Pharmacy, we really strive to provide the resources, the expertise, the solutions to really help our members fine-tune their business and enhance what their communities love most about them, which is the care that they give them. So because there are currently so many variations in state-specific legislation around clinical services and what services a pharmacy can provide, what things they can't, how they get reimbursed, this solution is just a really great addition to our range of our tools and our resources because it equips the pharmacist with the information that they need real time. It's kept very up to date. And it really allows them to stay up to date, not only on what they can do in their specific state, like what clinical services they can provide, but also help summarize reimbursement activities, what's approved, how you bill, what the medical codes are, and other important information. So the goal was really to give them the information they need at their fingertips to stay up to date and be able to continue to expand their clinical capabilities with flexibility.
So it is a very complicated environment, so that really helps the pharmacist.
Yeah, it really is. And we hope at some point we'll have some legislation that will be more uniform. But for right now, it really does vary significantly state by state.
That's excellent. So the next question I have concerns, the pharmacy deserts. We've heard so much about them and unfortunately some of the large chains moving. So where is the opportunity, do you think, for pharmacists to fill in the care gap?
Oh, that's a great question. And I'll start by answering the question specific to pharmacy in general, regardless of whether it's a chain or an independent space. And then I'll drill down a little bit further into the independent space. And, when I think about the pharmacy profession, we know that pharmacists are the most accessible healthcare providers in the U.S. And I'm sure you've seen the statistic that's out there according to the Centers for Disease Control and Prevention, but 90% of the U.S. population lives within 5 miles of a pharmacy. So they're highly accessible. And we also know that patients see their pharmacist more often than any other healthcare provider. So regardless of setting, regardless of whether you're a chain, you might be in a grocery setting, or you're an independent retail, you're highly accessible and really, really important to the patients that you serve. And then when you think about the independent space, so it's well known our independent pharmacies provide a high touch nature to their services. They know their patients' names. They're well integrated in the communities. They deliver to their homes. They often will come in and open the pharmacy in the middle of the night to care for one of their patients who needs a medication. So they do so much more than just dispense prescriptions. So to get back to your question, when you think about the broader public health needs and how the pharmacist's role has shifted, and really the pandemic is a prime example of that, right? We know local pharmacists assisted more with testing and treatment than ever before. And even now today, pharmacies remain the most common site for COVID vaccinations. So they've administered 31.1 million doses between September of 2023 and April of 2024. And when you contrast that with a physician's medical office, they administered 2.5 million doses during the same time frame. So we know they're accessible, and we know that there's a need for them to continue to engage with their patients in different ways beyond just filling prescriptions. So when you think about the pharmacy desert concern, knowing how accessible they are, knowing all that they do for patients, if a pharmacy closes, regardless of whether it's a chain or an independent, they leave a significant gap, often in socially underserved markets for these patients where there is no one to care for them. At times, there isn't even a provider or a physician nearby. And what's interesting, we did a study on this, and what we learned is that 20% of our Good Neighbor Pharmacy stores directly serve or are adjacent to a pharmacy desert, and 93.5 million US households are within reach of a GNP store. So our member pharmacies already every day, they work tirelessly to uncover and bridge some of the gaps of care in their communities. And we, of course, endeavor to support their efforts. But because they're doing all of that, at times they're completely overwhelmed. They have so much to do already. And then you fold in a number of patients who need extra care because a pharmacy closed. We need to help them. And one way that we're really working on helping them, and I mean, this is just the honest, truth of what it's like to operate a pharmacy right now, despite how accessible they are and their proven ability to take care of patients and important clinical services, they're all struggling due to unsustainable reimbursement rates and some of these state-specific legislative constraints on what they can and cannot do that we discussed at the beginning of the call. So the risk of pharmacy closures is real, and it will exacerbate the problem of pharmacy deserts and patient care, most importantly, particularly in some of those underserved communities.
Well, that's fascinating, though, that you have done some of those studies and you see the need and the challenges that pharmacists face, and you're really doing something about it.
Yeah, we really are trying. And I think one other area that we're focused on is around advocacy, because there's a lot of momentum in the way of bills, and there's progress both at the national and state level bills and ways that we can still help pharmacies achieve financial success so that they can continue to care for their patients and expand their scope of practice. So there's a couple different bills. I'm happy to go into them in more detail if you'd like. Otherwise, I know they're fairly publicly known, but we will continue, and our pharmacies continue to advocate for the right to be able to continue to care for their patients and do so in a way that provides fair and just reimbursement.
Well, that's the perfect segue for my next question. I'm going to ask you to look in the future and look in your crystal ball. What's the future for independent pharmacies?
It's such a good question. I think the future is really bright. We have some hurdles that we just discussed around reimbursement and expansion of practice, but I also have a ton of hope that we are going to find a way through legislation, primarily, but also through, I think, the public realizing they need the pharmacists to be able to continue to care for them. I have hope that they will continue to be an incredibly viable and successful part of their communities going forward. They're accessible. They provide high touch, high quality care to their patients. Their patients, it's so funny when we've done studies with patients asking them how they feel about their relationship with their pharmacist, and they're so highly trusted. And I think that's really important when you think about how vulnerable we all are as patients when we're sick and we have to go talk to somebody. The pharmacist plays such an important role. So I believe together we can drive the positive change that's needed to ensure that independent pharmacies remain a cornerstone not only of care, but of their communities for years to come. We know what they can do. They're incredibly agile. They've morphed their businesses many, many times as the kind of legislative landscape and the patient care landscape, especially through COVID, as we've seen that evolve. So I think we've all seen the impact that pharmacists can make, and I'm confident that now is the time to change the future for them so that they continue to be a viable part of their communities.
Well, that's fantastic. We really appreciate your insights, Jenni, and we hope you come back and share some more and tell us about some other developments you're working on.
I would love to. Thank you for having me.
My pleasure.